All right, well, it's 2 o'clock, so we'll get started. We have Anna Bonet with us today from Humana, and she is going to go over the 2025 rollout for Michigan. So please take it away.
Thank you for having me. So we're going to dive right in just in the to make sure we stay on time. So right here's your team in Michigan. We are small but mighty. So it's myself. Marissa Gonzar lives in Detroit. She's still on maternity leave, so she'll be joining us probably sometime at some point in October, early October, which we are excited to have her back. And Jason Hasman, who handles Michigan remotely. Jason lives in Duluth, Minnesota, and he you've probably spoken to him on the phone or received an email from him. Just to start with Humana, a reminder for those that have sold Humana, and if you haven't sold Humana before, this is the green Visa debit card that every Humana member gets. It's either loaded with their quarterly over-the-counter allowance, or if for SNP population, so DSNP or CSNP, that card is loaded with their monthly amount that they can spend on all sorts of things, which we'll go over shortly. Just a reminder, Humana does have Meijer in network as far as retailers. So I know in this first rolled out, we didn't have Meijer, but we were able to get them in our network of retailers back in May. So Meijer, in addition to Kroger, Walgreens, Walmart, Dollar General, etc., are all part of this. Okay, to start, I'm going to have some great news and some not so great news, kind of both, right? So as we go through these plans, hang tight with me. If you have questions, throw them in the chat. This is our zero premium PPO plan. It's not new. Actually, I'll only be showing you two new plans today anyway. So everything I'm covering basically is existing. The changes to this are mainly in the northern part of Michigan. It is no longer available in those grayed out counties. Tri-County, you have your own version of this plan. So you never had this plan to begin with. But northern Michigan, some of those counties we will be removing this plan from. Some changes this year. The MOOP is going up slightly. I tried to highlight it in that pink maroon color to make it easy, but 5,900 instead of, I think it's at 5,300 right now. We are adding a medical deductible, just like lots of our other friends in the market are adding medical deductibles this year. We are as well on this plan. 110 though, that is relatively low, which is fantastic. And you have to remember, Humana's medical deductibles do not apply to PCP, specialist, ER, urgent care, preventive, ambulance rides. There's a lot of other services it doesn't apply to. So yes, your member can go to the doctor day one and pay $0 at the PCP. Our inpatient hospital went up slightly to $440. It's about that amount on almost every plan now this year. So you'll see that trend. And then we added an RX deductible. Though I will say this, Humana took a pretty strong stance on prescription this year. And their strategy is this. Our strategy on RX deductibles are they only apply to tiers 3, 4, and 5. And we were able to keep tier 1 at $0 and tier 2 at $5. So I love that, really to make this still a really healthy, benefit rich plan while, enabling us to facilitate that $2,000 move on RX coming in 2025. I think it's fantastic. I also have heard that there's going to be little to no change on our formulary, so that's beautiful as well. Our OTC card is dropping slightly by $15 to $60 instead of $75 per quarter. So some changes on this plan. I think the important thing to remember is though, if you only sold Humana, you might think, oh my gosh, all these, changes. Well, yes, but when you look at the other plans similar to this in the marketplace, I think that this actually, fares extremely well and is still a very viable, great option for a large population. Okay, Detroit, we'll come back a slide. We're gonna go to your version of this plan. Detroit, Humana really beefed it up on this plan this year. I'm kind of excited because for 2024, most people in this tri-county area mainly sold the HMO because it was just so much more benefit rich. But this PPO is coming back swinging, I think. I'll compare and contrast it for you. That maximum out of pocket went slightly up, which you'll see that again, that trend, not just in Humana, but in lots of other carriers too. 440 for that inpatient hospital stay. We were able to keep that PCP and specialist the same. An RX deductible was added on this as well, only tiers 3, 4, and 5. This one had transportation added to it, which is great because so does the HMO. Actually, these two are very, very similar. And in fact, this dental has dentures in it. So it is a great option for Tri-County. I'm going to go over the HMO next. And that's not just Tri-County, it's a little bit greater area than Detroit. But as you can see, as we go through it, kind of keep this in your mind and kind of compare and contrast. So just a reminder before I move on, I hope everyone knows. Is everyone aware that Humana's PPOs are open and passive, meaning you can take them anywhere, see any physician, go to any facility, as long as they will agree to bill Humana? Your cost share, there's no like out of network cost share. It's the same. Your PCP is 0, your specialist is 40, and so on and so forth. Okay. Do we have people on here? I know that you're in Grand Rapids, but do we have Detroit people? I'm just curious.
I'm not sure anyone on here is actively lives in that area, but a lot of us do sell, statewide. So
Okay, so
good enough.
so you do want me to still cover this, correct?
Yeah, please.
Okay, sure. All right, so when you look at the HMO comparatively, yes, this maximum out of pocket is lower, right? The PCP and specialists are the same. The inpatient hospital is the same as the plan we just went over. This RX deductible is slightly lower, but everything else is basically the same. And the dental on this one doesn't get dentures. So my point in this is an HMO is a great option if you want a little bit lower MOOP and a little bit lower RX deductible. But just remember, you do need to stay in the HMO network. Now, you can travel with this HMO, you guys. There's no referrals or anything like that. You can go to Arizona or Texas or whatever for the winter. That's fine. You just have to make sure that when you're down there, you're seeking care from an HMO in network provider down there. We have a national HMO network. It's not just specific to Michigan. It's a national HMO network. So as long as you're utilizing a provider in that, you're good to go. Let me see if there's a chat. All right. Oh yeah, it's you. I know you know. About the PPO. So great. Okay. I'm going to move out of the zero premiums. This is still zero premium, but I'm going to talk about our 2 give back plans that we have in the market. I like this one this year. I actually like the next one I'm going to cover better for a majority of the population, though this is a good option for the counties where they no longer have the 384, the first plan we covered. It's a great option. But the Part B give back changed slightly to $66. The specialist went up slightly, so did the inpatient hospital. The RX deductible on this is currently $350 and is staying $350. Remember, tiers 3, 4, and 5 only. Some interesting changes this year. The OTC was removed and the dental was reduced from 3,000 down to 1,000. So again, this plan doesn't have a medical deductible, which is great. That's unique, but it still does have that RX. I'm going to now show you the next give back. And if I were sitting in your seat, this is probably the one that I would, where'd you go? And this is the one I would start. If I was going to really pay attention to something coming out of Humana, this would be it. Besides like some DSNP, CSNP stuff I'm going to show you. I love this plan because right now it's still $102 a month Part B give back. It's still that open PPO. You'll notice some of the northern counties are no longer able to get this plan, but not very many counties. So it's basically statewide. Deductible is being lowered again. Like it's currently, I think it's like 545 right now. It's being lowered yet again to 500. And again, the deductible does not apply to PCP, specialist, urgent care, all of those things. The inpatient hospital is only 400, where we're seeing 440, 450 on all the other plans. And you guys, we took the RX deductible off of this. The RX deductible right now, I think is 525 bucks. It's not small. And we're taking that thing right off the plan, which is amazing. There's no RX deductible. And look at tier 3. Tier 3 says $34. That's so cheap. Every other tier 3 med on every other plan we have is $47. That's a huge savings. And we're beefing up the dental. It's $1,000 currently, and it's moving for 2025 up to $2,000. I have always, this plan is always sold really well purely because of that Part B give back. And I used to, when it first rolled out, I used to tell people, because it had a medical and an RX deductible, both, north of 500. And I just used to tell people, with a move like that and the RX and the medical deductible and the skinny dental, this really is kind of geared towards a healthy person. No longer, you guys, with these changes, I feel like we took the consumer base from a pretty small, narrow niche consumer base to much, much wider. If I was a betting woman, I would bet that this plan is probably going to be the highest selling plan in Michigan. If not that, pretty darn close to maybe second. So if I were you, I'd start this plan because you're going to get asked about it anyway. Okay, let's set those populations aside and we're going to talk MA only. We still are the only carrier USAA recommended and endorsed. And yes, we still have that honor plan that we've had forever, it feels like, right? We were the first to market with an MA only plan geared towards veterans. So again, you do not have to be a veteran, but it's what it was really kind of created for. So good news this year, basically no changes. Yay! Why change perfection when you already have it? We kept that Part B give back at $100, and that is so essential. I love that. Our maximum out of pocket did go up, as all of our MOOPs did. We were able to keep all of our co-pays the same. You guys look at that inpatient hospital. $295 per day is so low. I love it. OT, the only change that your consumer is probably going to feel if they're on the plan right now. Right now, they have $125 per quarter on that OTC card. Moving forward, it'll only be $50 a quarter. I know that feels like a big decrease, but all of our plans are somewhere between $50 and $60 a quarter. This was just the outlier. Plus, I don't know, I guess I feel like 125 is a ton. And I don't know how many Band-Aids and Tylenol you're going to buy with 125 bucks a quarter, but I feel like 50 is more than adequate. You still get your silver sneakers, your hearing and vision, and $2,500 in dental. So for a veteran that may get all of their care through the VA and their prescriptions through the VA, this is a no-brainer. They don't even have to use the medical portion. They can still get their Part B reduction, their OTC card, their gym membership, and some dental work done. And it's there in case they need it, right? Should they need care outside of the VA, it's there. All right, I think this is kind of mostly what everyone was waiting for. Everyone kind of wanted to know, what's Humana doing on your DSNP? Well, I'll show you. Hold on. I had to take a drink of water. I've given this presentation so many times. All right. DSNP and CSNP, so also chronic condition plan members, their card is loaded with that monthly amount that we'll go over. Remember, it does roll over month to month till the end of the year, and they can spend it on lots of things. So yes, they can spend it on OTC. Yes, they can spend it on healthy foods, but they can also buy paper products, cleaning supplies. They could, shampoo, conditioner. They can pay Uber and Lyft. So if they need transportation, immediately, they can pay Uber and Lyft. You could pay your Comcast bill, your Xfinity bill, your mortgage, your rent, your electric bill, whatever. All of those things are different options on ways they can spend their money. So I'm starting with this slide because this was I think our highest selling DSNP plan. Well, yeah, I know it was. It is that open passive PPO DSNP. The changes this year are on this one kind of substantial. So 190 a month is what it's currently at on that card. It is going to 175. The dental on this one's 2,000. It is going to 1,500. An additional thing to note here is transportation is being removed. You might say, wait, DSNP needs transportation. They still get transportation through Medicaid and they still can remember, they can use that card with the 175 a month to pay Uber and Lyft. So though it's probably not exactly what you wanted to see, this is what it looks like for this year. And it's great that the footprint didn't change. So I'm happy about that. I still think when you look within the market, there's probably some other options that are higher monthly amounts, but you also have to consider, what concessions come along with that, right? Like, are we having to stick to a specific network and so on and so forth? Okay. Detroit and outstate, you still have this PPO DSNP. The reason this PPO, at least from if I'm sitting in your shoes as an agent, exists for two reasons. I only would use this DSNP if they didn't qualify to go into the full, like right here, because it only accepts 3 levels of Medicaid. If they don't qualify to go into that, then you have this option. Detroit, if they either don't qualify to go into the HMO DSNP or they just purely want a PPO DSNP, this is here for you. So this is kind of, I call it like, it's in your back pocket for when you need it. Yes, you can put spend down folks on this. I would just encourage you based on the note in the red. Please be careful when you have a spend down person, a person with a spend down, because if they are not cost share protected, they are going to pay the co-pays and the co-insurance until they meet that spend down in that month and become, quote, like full Medicaid for the remainder of that month. And then it starts right back over. So you have to be very careful with it. The only change on this plan this year is taking the monthly amount from 120 down to 100. So 20 bucks less. All right, Detroit, I am actually really excited about these changes because Humana is investing in these HMO DSNPs. And yes, I said plural. You might think to yourself, no, Anna, there's only one HMO DSNP. Well, currently you are right, but we have a new plan to show you. So I am going to compare and contrast the member profile, I guess, or what that member's priority would be when they're enrolling in this plan versus the new PPO DSNP, or I'm sorry, the other new HMO DSNP. Okay, to start with, this plan has transportation removed and it lowered the vision by $200, but still $350 is a very healthy eyewear amount. The biggest change here is right now it's $175 on the card per month and it's going up to $200 per month. So the person enrolling in this plan is like, yep, I live in one of the green counties And yes, I am good with the HMO because Humana's HMO network in the Detroit area is very, very wide, which is great. So I'm good with the HMO. I really just need that $200 a month. The $3,000 in dental works for me. I'm okay with the vision. I'm even okay with transportation, by using my card, whatever. The $200 a month is the hero here. This is the new plan, you guys. So nothing's in pink because it's all new. Also an HMO, but this HMO has $50 less on the monthly spending card. So instead of 200, it's 150. But what they do get here, the person enrolling in this plan is like, I'm good with $50 less a month. I need the transportation, those 76 one-way trips, and I need that $5,000 in dental because I need my dentures done now. So, and of course the vision's slightly higher, but that's really not why you're buying this plan. Two different buyer profiles here. This one cares about the transportation and the dental. This profile, this consumer profile really, really just cares about, whoops, I went too far. I'm going too far back. This one cares about the $200 a month. So $200 a month and lower dental, $150 a month and higher dental. Two different consumer profiles there. Do we have any questions about DSNP? So if I was Detroit, I would make sure I have both of these HMOs and then a couple of the PPO that ends in 385 as a backup should someone not want an HMO. If I sold outside of Detroit, I'd make sure I have that 388 plan, the one with 175 a month on it, and a few of the 385s just in case I need it from a Medicaid eligibility standpoint. So, okay, the members and their levels. Oh, Gretchen, you're right. Right now has been such a pain. Our eligibility tool right now is functioning partly. So this year's been fun with that whole Change Healthcare stuff. Our Medicare our eligibility tool is functioning if you want to check Medicare eligibility. So it'll tell you all of the stuff about like their, Part A and B effective dates and so on and so forth. The Medicaid eligibility side is not quite yet functioning. I have been told and promised that it would be functioning by 10/1. We shall see. In the meantime, members and you can do any of the following. A, you can call in to agent support and see if they are able to use their workaround tool to get you a level. That would be A. Another option, B, would be that the member or you call in and get their Medicaid level from the state. So you would need to do that with your member or have your member do that. Option C is they just recently got a award letter, the letter that shows them what level they are, and just hope it hasn't changed. So those are the options right now. Once our tool is functioning, you'll have that information at your fingertips. Yep. I know this tool has not been functioning for I don't know how many months, but believe me, when something's a pain point for you, it very quickly becomes a pain point for me. So I am pushing my hardest to get that done. They know how important it is. With the change in DSNP, yeah, I know. You guys, here's the thing with the tools. When Change Healthcare got hacked, it took everything down and basically put all of us carriers on our knees. Like we don't have the capacity to access information when this hack has basically severed the highway of information, right? Like so with that hack and them putting in all of these protocol into place to make sure it doesn't happen again, we are basically at their mercy until they have everything figured out so that we can actually plug in and get real-time information from them. So each carrier is programming and working and programming and working, but we can only do so much until they have their side of it fixed too. You know, that interchange of information does rely on both ends. So it's both us and, you know, what's feeding the state information too, which is partly that. So with that being said, and with DSNP SEPs going away for Michigan, because we do not have, you know, that HIDE, FIDE integrated plan stuff, we don't have it this year. That may look different for 2026, but for 2025, we don't have it. So that quarterly SEP is gone. That monthly, you know, whatever they're talking about in other states, that's not available in Michigan. So what is your plan to grow your business outside of, you know, because DSNP at this point is you're gonna sell like you would to anyone else. It's gonna be AEP, OEP, turning 65, and any other SEP like a move, you know, moving from county to county, those types of things. Well, with that being said, Humana this year for 2024, so right now, has a chronic condition plan. Before you tune your ears out, I would actually say if you're going to star something, now would be the time to pay attention. We have a CSNP. I'm going to go over the changes and why I think this is such a vital tool for your growth in your business. This plan is that open passive PPO, so you can use it everywhere. Next, the person has to have diabetes, any type of diabetes, and we don't care what medicines they take or whether they take insulin or not. They just have to have a doctor's affirm, yes, they have been diagnosed with diabetes, chronic heart failure, or cardiovascular disorders. We live in Michigan. It's a sedentary state, right? And we're working with over 65 for mostly, right? In that population, how many diabetics do you know? AFib. Let me just check. Hold on a second. Here, I'm gonna go forward. Here on the right side, ignore the lung stuff in the middle, guys. Michigan's CSNP does not include lung. This is a national form, and people like Indiana, I believe, and lots of other states have lung diseases, so just ignore that. Cardiac arrhythmias, I don't know if that would be considered AFib, but if a doctor can diagnose them with any of these on the right, or diabetes or chronic heart failure, that would be eligible for this CSNP. All right, I'm gonna go back to the plan. So yes, there is a tiny little $2 Part B give back on. It's so cute and little. I just don't exactly, you know, everyone asks me why is it there, and I'm like, I don't know, they put it on. The move went up slightly, but why you sell this plan? I'm going to compare this with a normal PPO, because realistically, that's what this population probably is in anyway. So let's talk about it. The move is going to be about the same. Our other PPOs are like 53 or 5200 and 5900. So not vastly different than the 6700 here or 6750. Again, 2 to 3% of the population even hit their move. But my point is, it's not drastically high. Where you're saving here is on what they really use. The specialist, for example, $35 versus 40. So you're saving $5 a pop there. Your RX deductible is lower. So on our other plans, they're $250 and $350, but this plan is only $200 RX deductible. And yes, you see a 0 at the back of that. There is a 6th tier, and it's $0. Right now it's $0 too. And things like Jardiance are on our tier 6 formulary. So they get their medication, their Jardiance, for $0 starting month 1. And there's no deductible. And now with 2025, with the 2000 max, plus they're getting rid of the 25% in the coverage gap, like you get zero all the time. Zero, your Jardians, yay. Who doesn't want Jardians for $0? I think it's fabulous. Okay, the other thing here I want you to know is in the OTC column. This is not OTC. This is $50 a month healthy options. So $50 a month compared to $50 or $60 a quarter on all the other plans. I mean, that's triple, right? $50 a month is $150 a quarter, guys. And they can spend it just like a DSNP. So they don't have to buy OTC items. They can use it when they're grocery shopping. They can buy their shampoo with it. They can, if they want to just use that $50 a month towards their Verizon bill, like go, you don't care. That's awesome. So they get to spend it that way. The other thing really important here is they have 30% coverage for dentures and crowns. Humana does not cover implants. We never have. Clearly we are not this year. And dentures are not overly common. Dentures are on a few of our plans, but not all of them. And to have this coverage on this plan puts it above the other PPOs for the most part. So when you compare these apples to apples, there's almost never going to be a time where you would put a member with diabetes in anything other than this. And you can write it year round. I hope you guys know that. You can write C-SNPs year round. The SEP code is CHR. I'm going to put it in the chat. SEP code is CHR. And it is good every month of the year. Now, if someone uses that CHR to go into the one and only other CSNP plan in the market right now, it's Humana and one other person in the game right now, guys. I think there's probably another one coming to the market for 2025. But point is this: if they enroll using the CHR in January, February, March, April, May, whatever, that's fine, but they can't use it again. So once they've used it to enroll in, for example, Zing has one in like the Detroit area. If they've used it and they want to go into Humana's, they can't. You can't use that CHR SEP code to get into the plan. You'd have to use a different SEP code. So once you use it in a 12-month period, it's done. Okay. But the great thing is, all summer long, when you're not, you don't have that DSNP quarterly option anymore, you have this in your toolbox. And it probably does apply to a vast majority of people in Michigan because of where we live. The only extra step as an agent for you, and there is one extra step, and it's populated in your enrollment. Like, what am I thinking? I'm blanking right now. Your electronic enrollment system, whatever you use, it's automatically populated, and it is this form. I know it looks like a lot of words. I'm actually going to break it down for you. It's not. Ignore the bottom section because we don't talk about lung anyway. Let's say the person's like, yes, I have diabetes. You answer no to literally everything else. But if you just have to answer one yes. Have you ever been told that you have high blood sugar or diabetes? Yes. And then you have the member's information at the top. You put the doctor's name at the bottom with their telephone number. Why? Because most of the time, not during AEP, but every other time of the year, Humana will make proactive outreach to the doctor to verify they have the condition. So get their signature, and that completes the enrollment. The next step, and this isn't for you agents, you are not involved in this other than just simply reminding your member, please have your doctor return the form. This form gets sent to your member with the top portion pre-filled by Humana, and they take this to their doctor, and their doctor simply checks the box and sends it back in. They can send it in through fax, email, the portal. They don't even have to touch the form if they don't want to. They can call in and provide verbal verification. And on top of that, not listed here, most of the times of the year, Humana will just proactively call them to get this done. Okay. They have 60 days to get it done. If they don't, they get involuntarily termed and it opens up the SEP for you to move them into another plan. Though keep in mind that other plan is probably not going to be, from a benefit perspective, as favorable for a diabetes patient. Okay, last plan, and this is it. It's new, and I'm actually really excited about it, though it is a niche market. It is another C-SNP, and it's just in Detroit, but Detroit, hear me out. It's end-stage renal disease only. And it's new. Humana likes to kind of test pilot things in a smaller area, as evident by the C-SNP I just showed you, and this one. But let's go through this together. Again, you can write this all year long, and we're thinking of end-stage renal disease patients only. So their specialist, because they go all the time, is $0. They have an RX deductible, but it's only tiers 4 and 5 only. Even tier 3 doesn't apply here. And tiers 1 and 2 are $0, plus their 6th tier is $0. Okay? So they don't have copays on tiers 1, 2, or 6. They have a flat copay on tier 3, and they have a deductible, then co-insurance on tiers 4 and 5. Also really awesome on this is they get the $50 a month, not a quarter, a month to spend, just like the D-SNP as well. What's really awesome here, though, is that unlimited transportation, because let's be honest, they're going to dialysis multiple times a week, and that transportation comes in handy. Our transportation vendor is changing. This year, we have been using Motive Care, but we are moving to Safe Ride. Yay, I'm very excited about that. They have an excellent reputation. So when I'm thinking about an end-stage renal disease consumer, this is an HMO. You need to check doctors and facilities. I already checked DaVita for you. DaVita dialysis centers are in, yes, they are in our HMO network. So that's fantastic. But I love this plan. It's just for a very, very niche population that really needs the savings on the specialists and on those drugs, and on the transportation. Okay, we are done with MAPD. The last thing I have gotten asked about a lot is, drum roll, PDP. If you sell PDP, I hope you perk up your ears, because Humana is paying full commission still for 2025. And we are taking drastic reduction in premium. So let's take a peek. First up, this is the basic RX plan. It's $3.20. It's got an RX deductible. You guys, you're really only ever going to use this for someone who is getting extra help or LIS, and isn't on a D-SNP for some reason. So that's pretty much how you're going to utilize this plan. This one doesn't pay commission now and won't pay commission moving forward, so there is no change. This is just a non-commissionable plan. But our other ones pay commission and will continue to pay full commission moving forward. So here we go. This is the one everyone was excited about. Most people call it the Walmart plan. That's how they've known it. It is the Walmart value plan, but we are dropping the Walmart name. So it is now just the value PDP. And the great thing on this one is there really is no change except for the premium. Right now it's $35 and some odd cents, and we are cutting that premium by more than half, down to $16.30. So I've just had so many like in-person people cheering when I can see their faces. If you were going to star something, I would star this one. The only other PDP we have is the Premier. I don't think there is a reduction in premium here. I think it's about the same. It might have even went up just slightly, not by a lot, but this one is, again, you're going to have a niche market here. This is one that someone is okay paying a pretty hefty premium for really broad drug coverage. Most of your consumer base in PDP is actually going to be over the what used to be the Walmart plan, the value plan. So, but here's the premiere just in case you wanted to take a screenshot of whatever. All right. Well, that is all I had to show you for this year. Humana, if you are, quick note, if you are if you have members, I'm gonna come back here, like in, sorry, I'm coming back to these PPO areas right now. Like for example, this one's available statewide. If you have members in these upper peninsula and northern Michigan counties, they will not be crosswalked to anything. You need to proactively place them in a policy or in a, an enrollment, whether it's with Humana or another carrier. So for example, the 385 or 384, which is taking a lot of change, like this is the one that's probably feeling the change. Like all those people in the UP, they need to be proactively placed in another plan. I think that's it. Any other questions?
Hi, Anna. I just got one question on that Humana, the value or the Walmart value PDP.
Yep.
Will they be issued new cards then? Just removing the Walmart word from there?
Yes, they will be.
Okay. And if anyone has a question, feel free to unmute, throw it out there, or put it in the chat.
I guess one other note, I will say I love that Humana is very clearly, like over the last year and probably 2 years, but really the last year and a half, Humana, especially in Michigan, has really grown in the med sup area. So if you haven't looked at that, I would encourage you to do that. We are ultra competitive in rate. And oddly enough, it's going to show up in the tool as Humana Achieve, or like the other option is Humana of Kentucky. It's just because Humana's in Louisville, right? But the Humana of Kentucky is what I call the traditional plan. That one, that traditional plan has silver sneakers on it. The Achieve does not. But oddly, the Achieve that doesn't have the gym membership is slightly more expensive. So we're selling the heck out of the traditional or Humana of Kentucky. Clearly, we are also making a push for PDP because we're slicing that premium by more than 50%. So encourage you to take a peek at that. If you have questions, let me know. But hope I answered most of your questions today and got you excited about some of the things.
No, that was fantastic. It was very thorough. Thank you so much for your time. It doesn't look like we have any other questions. If anything pops up, everyone, you can always reach out to Anna directly as well. So thank you so much, Anna, for your time. I appreciate it, and happy AEP.
Thanks, you as well. Bye.
Bye. Bye, everyone.